Good evening. Tonight it really is our pleasure to welcome Dr. Mitchell Goldstein, who's the Medical Director of the National Coalition for Infant Health, along with Susan Hepworth, who is the Director of the National Coalition for Infant Health. Thank you and welcome to Prolacta. Susan, can you tell us a little bit about the coalition, what its mission is, what its purpose is, and who are its members?
Sure. The National Coalition for Infant Health is a group of clinicians, registered nurses, neonatologists who really want to go beyond the bedside to try to give a voice to a voiceless population. We also have members that include patient advocacy organizations, parent groups, community health leaders, all aimed at trying to make progress with our lawmakers and policymakers to develop policies that benefit our most vulnerable population, everything from safety, access, nutrition, and equality.
Tell us a little bit more about the mission, the vision, and the values of the coalition.
The mission of the National Coalition for Infant Health is really to educate and advocate on behalf of this voiceless population. And so we want to advocate for things like optimal nutrition, for safety, and really so that parents of these premature infants have the tools that they need once they leave the NICU, so that they never have to return, so they have a really great quality of care upon leaving the NICU.
Dr. Goldstein, how did the coalition get interested in exclusive human milk for preemies under 1,250 grams?
Well, it started with the summit. We had a summit in Washington, D.C. earlier this year, and the emphasis was on trying to find what needs in particular were important for infants, in particular those who were born prematurely and those who are especially at risk. And when you look at those babies under 1,250 grams, that defines a risk group that clearly has more risks, especially for feeding. At the summit, we convened various focus groups whose mission was to look at and specifically identify areas where we felt that we could do better. And one of those areas was human milk.
And mothers of premature infants often struggle to provide necessary calories for their babies. And so how is exclusive human milk diet achieved in these babies?
Well, I think you have to first look at the predicate. And the predicate always has been to figure out a better way to get calories to these babies. IV nutrition is unsatisfactory, and certainly these babies don't grow as well as when they have enteral feeds. Unfortunately, the enteral feeds that we have had heretofore have largely relied on foreign milk proteins, specifically cow protein, to achieve weight gain. And again, when looking at babies and when looking at the data and when looking at the results of some of the more prominent studies that are out there, it has been shown that these babies have better tolerance and, for that matter, better growth and development when they're fed a diet which is exclusively human milk protein.
We heard a great saying at the summit that milk is medicine and breast is best, of course. Can you tell us about that, about why the coalition really sees milk as medicine for these infants and not just a nice-to-have nutrition?
Well, in fact, it's more than just medicine. When you look at milk, milk is in fact human tissue. And when we look at what is available for a small preterm baby, the best is that which is closest to what nature designed. When you look at the substitutes, when you look at what else is out there, it comes close, but it's just not satisfactory. And when you look at feeding intolerance and when you look at other problems that these preterm babies have, especially the long-term problems in terms of potential allergy and potential feeding intolerance, aversion to feeding, possibly as a result of intolerance to feeds, and more importantly than anything else, necrotizing enterocolitis, which is a very serious infection of the gut and bowel. By using an exclusively human milk protein, human milk diet, and human milk fortifier, you can assure that these babies have the best chance for the best possible outcome.
Can you explain to us the difference between a human milk-based fortifier and a human milk fortifier?
It's kind of a tangle of words, and when you look at it from a standpoint of the commercialization, it sounds like they're doing pretty much the same thing, but the reality is very different. The reality is that if you use a milk protein, which is human-based, that is, it derives from an actual human being as opposed to a cow or other source, you're getting something that was specifically designed for that baby. When you look at something that comes from a cow or a soy product, this is something that is perhaps close but not identical. And the results that we've seen, again, from a lot of these studies have shown that these babies have better feeding tolerance. They get less necrotizing enterocolitis, this very serious bowel infection. And more importantly, again, there are other types of concerns that we have for the long term. We don't know some of the things that these fortifiers will do 20, 30, 40 years out in terms of what they will contribute to morbidity and mortality of these people, whether it's heart disease, asthma, atopic dermatitis, or any one of a number of other things. By way of using an exclusively human milk diet, we can perhaps preempt these and lead and essentially have a healthier individual for his life.
One of the reasons that the National Coalition for Infant Health took on this issue of optimal nutrition is just as Dr. Goldstein suggested. The data is there, the science is there. These preemies need the best nutrition possible, and for them, that's an exclusive human milk diet. So one of the things that we advocated for at the summit that we had in June, which was our Preemie Matters National Policy Summit, the first of its kind, we brought together all of these different organizations, congressional leaders, congressional staff, to try to raise the awareness with them and also with the media, so that we can get policies surrounding this most important issue, and that can include making sure that preemie moms who leave the NICU still have access to hospital-grade pumps. That's something that's really important that can help with the exclusive human milk diet. So that's one of the reasons that we took it on, is because it's pretty obvious. The science and the data are there to support it.
These are really excellent points, and one of the things that I see as a neonatologist is so many of these preemie moms giving up way too early on breastfeeding and provisioning of an exclusive human milk diet. And one of the serious problems we see is the fact that they don't receive the necessary support through the hospital, through the pediatrician after hospital discharge. And again, as pointed out, the idea of having the availability of a breast pump, but also, again, options in terms of optimal nutritional provisioning are things that we really strive for with respect to the coalition.
Mm-hmm. One of the things I saw came out of the summit was a really strong statement about informed consent. And we think of informed consent for all kinds of procedures and medications that parents have to sign off on. But we haven't really thought about the sort of reverse of that, where if you're not giving them exclusive human milk, you're giving them something else, but they have no idea about that. And the coalition has made a very strong stake in the ground about having these parents have to know about what exactly are their babies receiving. So tell us about informed consent and what your views are about that.
Yeah, so because the exclusive human milk diet is so important, that is something that came out of the summit. Was all of these leaders thought that that was something that we needed to address, because it's such an important issue that preemie parents need really to opt out because it's so important. Instead of opting in for an exclusive human milk diet, we really need to have them be informed, so informed consent, and opting out of that important thing.
The word is really to assent, and that is that the parents are informed that we will be doing what's medically indicated and medically best for their child in terms of provisioning a human milk diet, an exclusively human milk diet. And yes, again, it shouldn't be forced upon the parents, but good data should accompany that discussion, and they should be made aware of the fact that, again, our intent is to provide something that's natural and what closely matches the baby's physiology. Mm-hmm. When you look at it from a standpoint of providing cow's milk-based formulas or those that are based on soy or other materials, again, this is the foreign protein. This is the stuff that the body reacts to. And it's our feeling that in many ways, perhaps the parents should be consenting to that as opposed to their babies receiving an exclusively human milk diet, which is what nature intended.
Makes sense. We heard a lot also about your concerns for quality and safety with donor milk as well as with human milk fortifiers. Can you share with us, I know Dr. Goldstein, you said human milk is a biologic, milk is medicine. How does the coalition take a stand on quality and safety and ensuring that these fragile infants get the highest quality and safety in donor milk as well as in human milk fortifiers?
I think that that's one of the reasons that we addressed the safety and the quality issue at the summit. We certainly don't want mothers going to other sources other than anything that can be 100% verified and tested and is totally safe for their premature baby. So that's an issue that we wanted to raise with lawmakers and community health professionals, policy people who really have sway in these decisions, that's if we're going to advocate for an exclusive human milk diet, we have to take the measures to ensure that all of that donor milk is 100% safe for those infants.
And Dr. Goldstein, from a clinical perspective, how do we do that? How do we ensure that the donor milk is safe?
Well, I think when you look at it from a standpoint of making sure that you have things that are in place, not only from a standpoint of checking very carefully that the people who you think are donating are in fact donating, but also from a standpoint of making sure that that human milk is as safe as it possibly can be. So you look for bacterial counts, you look for contamination within that. You make sure that you hold it to a much higher standard than that of many other things that are out there. And that includes, for that matter, standard milk that you would have available. In many ways, you want milk to be as safe as blood. And when you look at the advances that we've made over many years in terms of the blood industry, the screening for infectious disease, the making sure that the blood is safe, not just for the majority, but for 99.999% of the population, you're getting to the point that this is something that the vast majority of people can consider safe. You want parents to have a reliance in this. You want them to think of this as something that they can look at as being not only something that's best for their baby, but something that's not going to cause problems for their child later on in life. And so again, I think that the metric really is to make sure that when you have something that is quality, that that is in fact as well safe.
Obstacles. We've heard a lot about obstacles that moms have in achieving good breastfeeding, having enough supply, and helping them along the way to add those calories and extra fortification. What are some of the things that the coalition is advocating for to help moms?
Well, one of the things that we're advocating for also came out of our Preemie Matters National Policy Summit in Washington, D.C., and that is that we want insurance to cover hospital-grade pumps once those mothers leave the NICU so that they have access to that to continue feeding their babies as optimally as possible.
Exactly. Dr. Goldstein, anything?
And again, to echo what was said with respect to insurance, we really need to work on this very, very closely. And again, it's not about just today, it's about what happens tomorrow. A lot of these small preterm infants will develop morbidities, will develop problems later on in life, will have growth deficits, will have problems with maintaining weight, will have other issues that involve development. But the one thing that we can do, and the one thing that we can do very well, at least at this point, in terms of preempting a lot of these problems, is to provide them the best possible nutrition. And again, it's very important that the insurers understand that if they go in the direction of nutrition, that it will reap good outcomes for them and they will have less cost-based problems later on with these children.
You talked about necrotizing enterocolitis. As a provider, a neonatologist who sees the damage of that and the reduction of it based on an exclusive human milk diet, just give us some more texture around that and how important you feel as a provider from what you've seen in your practice that makes in this tiny little 1,250 gram or below baby.
Well, the effects of necrotizing enterocolitis can be devastating. Many times we look at it as just being a little bit of feeding intolerance, a little bit of time for the baby to recover. But on its mildest, it's something that still causes the risk for stricture and problems later on with feeding. At its worst, it's the parent's worst nightmare. It's a situation where you have gross destruction of the entire bowel. It can be fatal. In other situations, there can be loss of up to 80 or 90% of the bowel. And what we've created is a child that is nutritionally crippled for the rest of his or her life. There's been certain success with bowel transplantation, but this is a very, very expensive procedure, and again requires a baby to have medication for his or her entire life. When you look at it relative to the context, and again, understanding that there are costs to provide what is a safe and quality-based solution, the provisioning of an exclusive human milk-based diet is the one way that you can basically stand up and do something about this and prevent a lot of these morbidities.
Excellent. Susan, what progress does the National Coalition hope to make on the issue of exclusive human milk? And what things will you put in place to create awareness, to broaden your reach on Capitol Hill as well as in the media, and to make the voices of these voiceless children known?
Sure. I think one of the things that we have to do in order to move the ball down the field as far as exclusive human milk diet is concerned is that we have to raise awareness about it. This is something that experts like Dr. Goldstein know all about. It's not necessarily something that a brand new mom who maybe had a premature infant that she didn't know was going to be premature and they hadn't had time to do the research. That's something that's really important, is that we actually have to raise awareness about it. And we have to raise awareness not only for those moms and dads who are having a premature infant, but we have to raise awareness with our policymakers and our lawmakers in Washington, D.C., so that once again we can create the kind of policies that give preemies and their families all the tools to be as healthy as possible.
And I know the coalition is very active in social media.
Yes.
Infographics,
Yep.
policy briefs. Dr. Goldstein has a policy brief coming out next month
Right.
on the exclusive human milk.
Yeah, so there are several ways that we try to raise awareness, and we also try to do it through the media. They're a very powerful voice, as we know. We do policy briefs, web videos. We're very active on social media, blog posts. We try to get those out to as many organizations as possible, ask them to share that information, and hopefully we sort of hit enough people that it will start to make a difference, and I know that it will.
This is not a secret, but it really requires that we get the information out there so that there's a much more broader knowledge and a more educated population that's determined to get the best for their babies.
Right. Well, during Prematurity Awareness Month, we really want to bring a high spotlight to this issue. And I know with your policy brief coming next month, tell us some of the other things you all are doing during Prematurity Awareness Month to highlight the work of the coalition.
Yeah. Well, we're obviously, as we said, very active on social media, and that's one thing we did today. And we would encourage everybody to maybe change their profile picture to the World Prematurity Day. It's got a little hashtag and it says November 17th, which is the actual day of the month. But it's just one of those things that will catch a lot of folks' eyes. Why is everything purple this month? You know, I'm wearing a purple dress. It's because we care about preemies, and that's the color for National Prematurity Awareness Month. So we'll continue to do things like that. As I said, you know, when this policy brief comes out, we'll make sure that that gets to lawmakers' office on Capitol Hill. The folks that we've partnered with already who, you know, perhaps came to our summit and spoke to us, these are lawmakers who have had real situations affect them in their life with prematurity. We'll make sure that they have that information, and so that they can come to us as a resource. We're very plugged into the premature community. When they need a parent perspective, we can perhaps find that parent perspective to help them to shape and craft these policies.
And again, I think when you look at it from a standpoint of where we're going with this, we want preemies really to have more of a voice. And so as for now, we are the coalition. We provide that voice for the preemies. But we need to make this better. We need to grow this. And the hope is at some point to actually have a congressional caucus to support and to advocate and to help us put the laws in the books to really help our babies.
Thank you all so much for joining us today.
Thank you.
Thank you.
Any closing statements, Dr. Goldstein?
As Medical Director of the National Coalition for Infant Health, we would like to congratulate and really applaud the efforts of those who are helping us make National Prematurity Awareness Month the sort of occasion that really honors and benefits our most at-risk infants.